Ladies and gentlemen, the colleagues from the National Medical Association of Japan, Korea, India, Taiwan, and all CMAAO member countries, a very warm welcome to the COVID-19 Symposium, Holistic Care, Healthcare in the New Era. We are honored to organize this special event where we will exchange what we did and learned during this global pandemic. First, allow me to introduce Dr. Kichiro Matsumoto, the president of Japan Medical Association. He has recorded his welcome message for today's conference. Let's share and watch the video.
皆さんこんにちは。日本医師会会長の松本です。Covid-19 シンポジウム、新しい時代における全人的医療の開催して、日本医師会を代表して一言ご挨拶申し上げます。はじめに台湾医師会周会長、韓国医師会李会長、インド医師会新会長と本日のシンポジウムを共催できますことに感謝申し上げます。特に周会長をはじめ
I'd like to thank President Chiu and the members of the Taiwan Medical Association for their effort in planning and organizing this symposium. Nearly 3 years have passed since COVID-19 began to rage across the world. And Japan is still in the midst of the 7th wave of the outbreak due to the Omicron variant, and the healthcare delivery system is under serious pressure nationwide. Under these circumstances, the Japan Medical Association has proposed measures to improve the situation, such as establishing a system with the triage function in communities, sending member physicians to community outpatient and test centers operated by prefectural medical associations and others, following up home care patients, and collaboration between elderly facilities and willing healthcare institutions. Together with local medical associations, we are working to realize these measures. The post-COVID era is still not in sight, but other emerging infectious diseases are also bound to appear regularly in the future. We wish to prepare better by taking into account of the COVID-19 experience, by having solid discussions on thorough prevention, establishment of treatment methods, enhancement of test systems, development of initial response systems, strengthening of hospitalization systems, securing of hospital beds, etc. Lastly, I'd like to conclude my remarks with the hope that today's symposium will be fruitful and lead to the end of COVID-19 as early as possible. Thank you. August 26, 2022, Kichiro Matsumoto, President of JMA.
Thanks to Dr. Matsumoto for your wonderful remark. Next, Dr. Pyo Su Lee, the president of Korean Medical Association, has also recorded his welcome message for today's conference. Let's share and watch this video.
Respected members of the Taiwan Medical Association, Japan Medical Association, India Medical Association, and Korea Medical Association. Hello, I am the president of the Korean Medical Association, Dr. Pyo-Su Lee. Despite having to greet you with a video, I am very pleased to be able to participate in this symposium, where scholars from 4 nations will hold enthusiastic presentations and discussions regarding COVID-19 response. I am very excited that following the joint symposium of the Taiwan Medical Association, Japan Medical Association, and Korean Medical Association held on October 29, 2021. The Indian Medical Association has joined this year to make this a 4-nation joint symposium. I would like to extend my gratitude to the Honorable President of the Japan Medical Association, Dr. Kichiro Matsumoto, President of the Taiwan Medical Association, Dr. Taiyuan Chu, and President of the Indian Medical Association, Dr. Sajanand Prasad Singh. Furthermore, I wish to express my deepest respect and appreciation to the Taiwan Medical Association that worked hard to prepare for today's symposium. Esteemed members of the Medical Association of Taiwan, Japan, India, and Korea. In order to quickly overcome the current situation where the coronavirus variations is causing a full-fledged resurgence of the pandemic in Korea, the Korean Medical Association is making preparations for quick one-stop diagnosis and treatment for COVID-19 patients centering on neighborhood clinics, supporting the establishment of a safe treatment environment where medical institutes are highly interested in infection control, so that COVID-19 patients can feel at ease receiving examinations and treatment, and has created a window for round-the-clock communication to make it possible to hear the options of experts and medical sites and reflect them in policies, thus allowing the medical sector and government to cooperate organically. Distinguished members of the Medical Association of Taiwan, Japan, India, and Korea, COVID-19 has brought about great changes in the lives of the people all around the world, and in my opinion, improvement to lifestyles and medical systems will be necessary even after the pandemic. At this juncture, I believe that this four-nation Medical Association joint symposium is very timely. And I would like to once again thank President of the Taiwan Medical Association, Dr. Taiyuan Chu, who worked to make this possible. Medical professionals are staying next to patients to treat them during the crisis of COVID-19 pandemic. And I wish to use this opportunity to once again express my deepest gratitude to the hard work and sacrifice of medical professionals all around the world who are fighting desperately at the front lines to protect the health of citizens and the safety of patients. I hope that at today's four-nation Medical Association Symposium, scholars from the four nations will hold in-depth presentations and discussions on occurrence of COVID-19 variants and tasks for the post-COVID-19 pandemic era, prevention and management after COVID-19, and improvements to the medical system for the world after COVID-19, so that it may serve as a valuable opportunity for sharing experience with other countries. I wish for the best to everyone who prepared for today's symposium and who participated in this symposium online. Thank you.
Thanks to Dr. Lee for your inspiring talk. Next, let's welcome Dr. Sahajan Prasad Singh, the President of Indian Medical Association, to give us his welcome remarks. Dr. Singh, you have the floor.
Thank you very much, sir. Dear Dr. Taiyuan Chu, President, Taiwan Medical Association, and CMAAO Dr. Kichiro Matsumoto, President, Japan Medical Association, Dr. Phil Stewart, Live President of Korean Medical Associations, and the learned speakers, moderators, and participants, Dr. Ved Prakash Mishra ji, Dr. Shokan ji. I am happy that Taiwan Medical Association has taken the initiative to organize this symposium on COVID-19, focusing the holistic healthcare. COVID pandemic hit us like a bolt from the blue. The entire world was captured by the damned coronavirus in a matter of few days and brought the entire world to a standstill. At the outset, none of the experts but predicted that the pandemic will be continued over 2 years. India alone witnessed over 44.3 million of COVID cases in last 2 years, with mortality over 5 to 7,000. Indian medical associations, with its entire membership across the country, stood firmly with the government of India under the able leadership and guidance of Honorable Prime Minister of India, Sri Narendra Modi ji. Not only they implemented the guidelines issued by the COVID control, but also actively participating in the decision making and guiding the government regarding appropriate COVID care and management. This is now we could reach our more than 2 million doses of COVID vaccination till date. The COVID pandemic also left, left positive impact on healthcare delivery system and the field of human resources management, material management, supply chain management, patient transport management, environmental health management, nutritional management, etc. The domestic production of medical devices and medicines are given a boost to meet the unprecedented domestic and global demand. I am sure that learned speakers of today will embark upon the way forward in the post-COVID era and will also enlighten us on management of similar situations in the future. My sincere thanks to Dr. Chu and this team. Thank you very much, sir. Thank you.
Thank you, Dr. Singh, for your wonderful remark. Now, it's my great pleasure to introduce Dr. Taiyuan Chu, President of Taiwan Medical Association and the President of CMAAO, to deliver his opening remark. Please, President Chu.
Dear Dr. Kichiro Matsumoto, Dr. Pyosu Lee, Dr. Sahajana Praza Singh, Dr. Yewei Zhong, distinguished guests, ladies and gentlemen, it gives me great pleasure to welcome you to this gathering. Since its outbreak in 2020, the COVID-19 pandemic has overwhelmed health system all over the world and profoundly impacted the healthcare system. Taiwan, for instance, has seen several traditions from applying precision public health measures to contain the spread in the early stage, deploying a tier care model in response to the COVID-19 case surge, to addressing the long-term need of COVID-19 survivors. These challenges brought out new horizons in terms of utilization of health data, telemedicine, primary health care, as well as holistic medicine. In the face of the crisis and its implications, I realize as the president of CMAAO and the collaboration between nations cannot be more important than now. Following the announcement of Taipei's statement on collaborative work managing novel pandemic pathogens, significant efforts have been made by CMAAO members. For example, last year, we organized a symposium which welcomed representatives from Taiwan, Japan, and South Korea to discuss the role of national medical associations in vaccination rollout. We also had the opportunity to exchange information with peers on the platform of the CMAAO International Weekly COVID-19 Update. I'm extremely delighted to have colleagues from Japan, South Korea, and India with us today in the symposium to shed light on how we can move the holistic care model forward to establish a comprehensive healthcare system as we enter the post-COVID era. I hope you will enjoy today's program, and I wish the conference with great success. Thank you.
Thank you, Dr. Chiu. Next, it will be our privilege to have Dr. Ye Wei-zhong, Chair of Council, CMAAO, to give us a precious speech. Please, Dr. Zhong.
Thank you very much. Can you hear me?
Yes.
Thank you very much for inviting me to give this speech. I'd like to thank Dr. Kichiro Matsumoto, Dr. Pisu of the Japan Medical Association, Dr. Pisu Lee of the President of the Korean Medical Association, Dr. Sahajanan Prasad Singh, President of the Indian Medical Association, Dr. Tai Yuan Chu, President of the Taiwan Medical Association, and also our current President of CMAAO. Thank you very much for the Taiwan Medical Association for reaching out to me for this privilege of giving this speech on this COVID symposium, Holistic Healthcare in a New Era. I would like to start by having some recollection of what has happened in the last 2 to 3 years. And I still remember that in December 2019, I was on holiday in Japan when I saw a CNN news about a very strange pneumonia that had appeared in Wuhan. And I said to my family members, I said, we must be careful of this because this pretty much sounds like SARS all over again. And we had been through SARS in 2003, especially Singapore, Hong Kong bore the brunt of SARS. So somehow there was a bit of fear and trepidation when I saw that CNN report. And by the time I came back to Singapore after my holiday, I had found that the news was indeed true, that this disease was something very similar to SARS. And of course, SARS came and went in 4 months, but in Singapore, and the toll globally was maybe 800 deceased. But this, I had no idea that would have raged on for 2.5 years. And to date, I think has claimed the lives of 6.5 million and infected more than 500 million people. So really, it's been a very, very tough 2.5 years for all of us. And I still recall that we watched in trepidation and horror as the Chinese tried to lock down a city of 11 million people and a province of 60 million people, and scrambled to build an ICU hospital of 3,000 overnight. So these were indeed some harsh lessons. The genome was published in January, I recall. And of course, everybody started work on vaccines and so on. But we watched the pandemic rage on, and I recall WHO, announcing it as a pandemic somewhere in January of 2020. And in Singapore, for example, we entered a lockdown in April lasting till May. And it was quite a severe lockdown for us. So overall, we watched in the first year as the virus rolled on through many countries, pushed big countries like Japan, Germany into recession. I recall somewhere in the middle of the year, and had ravaged continents. And for example, India in September, and with the onset of variants, Delta, Omicron coming out in late 2020 and in late 2021. On our side at CMAAO, we had our brave president, Dr. KK Agarwal, who held weekly sessions for us. And unfortunately, on May 17, 2021, he also succumbed to the virus. So this has been indeed a very tough and momentous, and certainly something that we would not forget easily in a long time. On a more optimistic note, I remember receiving my first Pfizer vaccine in January 2021, and that was only 1 year after the genome was published. So that was incredible that such an effort had taken place in just 1 year, and followed by monoclonals and antiviral medicines today like Paxlovid and Molnupiravir. It's indeed quite heartening to see the response to such a huge threat. But now, as we enter into the post-COVID phase, we also realize that there are huge challenges ahead. For example, COVID has pushed aside all the viruses for 2 years, and now influenza is coming back, monkeypox. In Singapore, for example, our dengue is raging again, and so on. So really, all the viruses are trying to come back to claim the space that they had occupied before. And this is yet another challenge. On our healthcare systems, I think we've seen the brunt of it, and we're now really experiencing the brunt of the pandemic. And that is because over the last 2 years, all our elderly patients have been deconditioned. They have lost muscle mass, they have lost cognition, they have not gone out, they have not socialized, they have not gone walking. And now we are seeing a huge deluge of elderly who are deconditioned coming into our hospitals and straining our healthcare system as COVID starts to fade away. And I don't think it's still fading, because we still are very concerned about possible more subvariants coming. And the threat is always on the horizon. But yet, I think with all the losses that we've sustained over the last 2 years, whether be it travel, loss of freedom, wearing a mask all day, N95, uncomfortable PPE, and economic loss, people who have lost their family members, all these losses have led to a huge grief reaction for the population. We are all going through anger, denial, bargaining, sadness, and finally acceptance and finding meaning. So it has been a tough 2.5 years for all of us. I kid you not. And but yet I think we should still look forward to soldiering on and taking the best care of our people, especially our elderly, who have also bore the brunt of the disease, and move on and consolidate our networks and find some pan-coronavirus vaccine, etc. And hopefully, we will see the end of this huge pandemic, which we have never in our minds imagined to be. So thank you very much for this opportunity to address all of you. And I wish you all a best and fruitful afternoon or morning for some of you. And I look forward to hearing from all our speakers. Thank you very much.
Thank you, Dr. Zhong, for your comprehensive talk. Then we will have a group photo. Now, I would like to invite every room participant to turn on your camera. We will take a group photo for this remarkable moment. I would like to invite every participant to turn on your camera. We will take a group photo for this remarkable moment. Please wait for a minute while we make sure everyone is in. All right, please follow me. 3, 2, 1, say cheese. Cheese. Again, everyone please thumbs up. Thumbs up. 3, 2, 1, say cheese. Cheese. Okay, thank you for your cooperation.
Thank you.
Distinguished guests, ladies and gentlemen, we are moving on our first session. We are very delighted to have Dr. Hidehito Imamura, Executive Board Member of Japan Medical Association, to chair the first session, which will focus on the current status of Japan. The floor is yours, Dr. Imamura.
Hello, everyone. I'm Hidehito Imamura, Executive Board Member of the Japan Medical Association, JMA, and Secretary General of SYMAAO. Now we are going to start the session organized by the JMA. The topic is current status of post-COVID conditions in Japan. The speaker is Dr. Satoshi Kamayachi, Executive Board Member of the JMA. Dr. Kamayachi graduated from the Nippon Medical School in 1978, and he has served as the director of Koizumi Pediatric Clinic since 1988. At the JMA, he was elected as the Executive Board Member in 2014, and he has been in charge of General Affairs, Infectious Diseases, Vaccinations, Academics, and Continuing Medical Education. He is working as a member representing the JMA at the committees of the Japanese government discussing the countermeasures against COVID-19 and plays an important role as a medical professional in the government's policy decision. Dr. Kamayachi, please.
日本医師会常任理事、釜谷聡と
My name is Satoshi Kamayachi, Executive Board Member of the Japan Medical Association. I am responsible of immunization infections, of infectious disease crisis management measures at JMA. Today, I would like to talk about the efforts made in Japan to address the so-called post-COVID conditions. The number of infections with COVID-19 is increasing in our country as well. Currently, the majority of infections is caused by the Omicron variant, especially BA.5. And so far, previously, we have experienced in Japan various types of variants of COVID-19 infections in our country. The post-COVID conditions are basically the symptoms which remain after 2 months of being affected with COVID-19. And in many cases, some symptoms remain for up to 3 months. And in some cases, acute symptoms continue, and in other cases, symptoms that had temporarily subsided may reappear later. Main symptoms include lethargy, malaise, and difficulty of breathing, foggy head, and inability to perform as efficiently as before, and difficulty getting enough sleep. So various efforts are underway in Japan to address the issue of how to deal with these post-COVID conditions. In June of 2022, the Ministry of Health, Labor and Welfare published Management of Post-COVID Conditions, which is a treatment guideline for the post-COVID conditions. This guideline has been updated successively and currently is being in the process of updating for the latest version. In addition, academic research is currently being ongoing in a variety of ways to identify and determine why these post-COVID conditions occur, but the background causes and other factors have not been fully understood yet. This next slide shows the management of post-COVID conditions, which is an annex to the guidelines for COVID-19 clinical practice, and it is being used in the clinical field. Now, I would like to first inform you of one study on changes over time of main post-COVID conditions. This is from January 2020 to February 2021. And this is a follow-up study of 1,066 patients diagnosed with COVID-19 aged 18 years or older with a history of hospitalization. So from this period, the symptoms were followed up closely up to 1 year later. The results show that even after 12 months of diagnosis, about 30% of all affected patients had one or more post-COVID conditions. This seems to be a fairly high rate. However, the frequency of each symptom decreased over time. Looking at the main ones, each symptom has 3 bar graphs on this side, and the left side shows the frequency of symptoms 3 months after the diagnosis. The second, the middle bar, shows the frequency at the 6 months after diagnosis, and the right side bar graph shows the frequency of the symptoms at the 12 months after diagnosis. These 3 bar graphs are arranged in one set for each symptoms, and the one that seems to be the highest on the graph is the first one, which is malaise. The next is dyspnea, which is followed by muscle weakness, and difficulty concentrating, and the taste and olfactory disorders are also included. So this is the course of cases for almost a year from January 2020. Just after the outbreak of the COVID-19. Next, this is another study. It is a study of lung function and the CT scanned images of patients with moderate severe symptoms, basically patients who had pneumonia with COVID-19. In Japan, moderate COVID-19 is categorized in two categories of moderate or moderate/severe. And in any case, moderate COVID-19 patients have had pneumonia. And this study was conducted on 1,003 patients aged 20 years of or older who were suffering from pneumonia. And the study period was 1 year from September 2020 to September 2021. So this study is from the viewpoint of post conditions and the lung function. Now, unlike the previous graphs, this shows 3 months, 6 months, 9 months, and 12 months after in one set, with a ratio of appearance of each symptom. So here, the most frequent symptom was muscle weakness. The next is dyspnea, malaise, sleep disorder, and reduced ability to think in the order. So this shows how symptoms have been remaining for the patients who have had pneumonia. The next slide shows in a similar way about the image. At 3 months after the diagnosis, the percentage of patients with abnormalities on CT scan images was 48.9%. So after 3 months, half of the patients had some abnormalities on CT scan. And after 6 months and 9 months over time, the number of patients having abnormalities decreased. But even after 12 months, 6.3% of the patients still had abnormalities on CT, indicating that the symptoms are quite prolonged. The next slide shows a study on the olfactory and taste disorders that are said to be characteristic of COVID-19. Until the Delta variant, olfactory and taste disorders were very problematic. But with the Omicron variants, which are currently prevalent, they have become less of a problem. And these data were obtained before the outbreak of Omicron variant. So the data are, as you can see on the slide, because they were obtained before the Omicron variant. So this next slide shows the data from the Tokyo Metropolitan Government. And this compares the post-COVID conditions of Omicron variants, which became the mainstay of infection since January of this year, 2022, with the pre-Delta variants, which were prevalent previously. The light blue colored bar graph shows about pre-Delta, and the darker blue corresponds to Omicron variants. First of all, we can see that cough and malaise are quite a complaint with the Omicron variant. Then we see that the taste disorder and the olfactory disorder have clearly decreased with the Omicron variant. The rightmost column shows the number of symptoms classified as others. And these others include various symptoms such as physical pain, shortness of breath, memory loss, heart palpitations, and so on. So the others have increased since Omicron outbreak started. The results clearly show that the symptoms classified as others have increased with Omicron, therefore. Now, in light of these post-COVID conditions, I'd like to talk about what our medical association has been doing so far. First, Japan Medical Association has strived to promptly provide information on post-COVID conditions based on scientific findings. And then the JMA has also been involved in the preparation of the guidelines for the post-COVID conditions treatment that I mentioned. And we have also asked the prefectural medical associations and county and city medical associations to establish local treatment systems for post-COVID conditions. In our desire to inform the public about a wide range of post-COVID conditions, we have been working to raise awareness through our official YouTube channel and other media that can be viewed by many people. And some prefectural medical associations have also been actively taking initiatives to address post-COVID conditions. For instance, the Saitama Medical Association has created a casebook for the post-COVID conditions treatment. And the Ibaraki Prefectural Medical Association has cooperated with the prefectural government to firmly establish outpatient care facilities for post-COVID conditions. In any case, when a patient comes to medical institutions complaining of post-COVID conditions, we need to be attentive to the patient's complaints, listen carefully to the patients about their symptoms, and work on how we can improve the conditions. While we must continue to train specialists in this field for the future, I believe also that the further work is required to properly determine the medical institutions that can be the main platform to provide consultation services in each region. The next slide shows how municipal governments are dealing with the post-COVID conditions. This is the situation as of June of this year. The number of consultation offices for consultation about post-COVID conditions is 157 out of the 157 municipalities which were covered by this survey in Japan, which means that the consultation offices are ready. However, when we take a closer look at some details, we find that there are still issues to be addressed in terms of whether medical facilities are adequately prepared to handle such cases of post-COVID conditions, and whether outpatient consultation services have been established in each region in a manner that facilitates consultation for the patients. So we believe that we must do our utmost efforts to publicize relevant information on our website and other media, and to improve our consultation services. The last slide is about the future issues. In any case, what these post-COVID conditions are truly have not been fully understood yet. So we need to continue our researches about why post-COVID conditions are occurring in many cases after being affected with COVID-19. On the other hand, many patients are in great pain due to these post-COVID-19 conditions, even before the full understanding about how to cope with them is achieved. So, as I mentioned earlier, physicians are strongly required to be attentive to patients' complaints and address them together with the patients, aiming for a solution. So that is my presentation about the current status of post-COVID conditions in Japan. Thank you very much.
This concludes the JMA's session. Thank you for your attention.
Kamayachi. Thanks for the brilliant presentation by Japan Medical Association. The second session will be chaired by Dr. Chong Yu Park. Dr. Park, you have the floor.
Thank you very much. Good afternoon, experts and our participants from the around 4 countries symposium. As Dr. Park, friends call me JP, so if you don't remember my name, you can just recall me as JP. I'm currently the Vice President of the Korean Medical Association, mainly responsible for the Scientific Committee and International Affairs. So we all agree that the COVID pandemic is not yet, still evolving. However, but facing a new era with multiple variations, newly infected with more number of repeated infected patients, as well as long COVID conditions as mentioned. So I believe that following our last October symposium, I believe that this is timely planned and well-arranged symposium will, I believe, provide in-depth knowledge about current pandemic situation in each country, will add more in-depth information and strategy for comprehensive approach through very important international communication and collaboration for our continuous efforts to fight against COVID-19. So this time I'm very happy to introduce our session's speaker, Professor Ho-Ki Yum. Professor Yum, shortly, he's currently the professor of Department of Internal Medicine and Pulmonary Division in Inje University. And he has served more than 2 years and still serving as a director of COVID-19 expert committee of Korean Medical Association and has worked very hard for this mission and shown a great leadership. So today's topic is under the similar name, COVID-19 Symposium, the Holistic Healthcare in New Era in Korea. So without further ado, I'd like to ask Professor Yum to take over this microphone. Please, Professor Yum.
Thank you very much for introduction, Vice President J. Jung Park. So can I now start? Can you hear me? Okay. Dear colleagues from Japan and Taiwan and India, thank you for your invitation to this honor webinar. I'm delighted to join the 4 Nations web seminar for COVID-19. I'm Ho-Ki Yum, coming from Inje University Seoul-Baek Hospital. My major is pulmonary science and critical care medicine, serving as chairman of expert committee COVID-19 task force of KMA. I'm going to talk about holistic healthcare in the new era of Korea. Please, next slide. Next slide. Yeah, thank you. And actually, I'm going to talk according to 3 agendas as you suggested in this slide. First, emerging of variant strain. Second, long COVID. Finally, improving the healthcare system for the post-COVID world. I want to comment these 3 agendas shortly and discuss later. Next slide, please. Yeah, first of all, SARS coronavirus 2 virus is so variable and change. But a healthcare system is too rigid to care of viral infections. The emerging of variant strain challenges in the era of the post-COVID pandemic. There is many variants of SARS-2 viruses such as Alpha, Beta, Delta, Omicron, and subtypes. There are big changes in quarantine before and after Omicron. We can care of patients with less protective from 6 pieces protection to 4 pieces. But it takes 2 more years to change this principle in hospital. Next slide, please. On this graph shows remarkable increase of COVID-19 compared before Omicron. It's not comparable. The instance is quite different from after Omicron variation in the world and in Korea also. Next slide, please. Next slide, please. Yeah, thank you. After Omicron variants, the instance of COVID-19 is extremely higher than before Omicron, wherever in the world, such as US and Korea and so forth, everywhere. Yeah. Next slide, please. Yeah, in Korea, this data showed the instance, death, and mortality are different by ages. The instance is higher at over 60 than less than 60. And death and mortality also significantly increase over 60. This is the key point to change the strategy against COVID-19 in Korea. Next slide, please. This is a vaccination rate in Korea. Now we got over 80 of all people vaccinated, twice more. And total confirmed case in Korea is 22.5 million people. It's almost 43.5% of all people. I guess the more infected case, there is a more infected case because there is missed cases and asymptomatic patients are not counted. Higher vaccination and infection rate can get herd immunity. This is another reason to change the strategy in Korea. Next slide, please. Yeah, as you know, the Omicron variant shows higher infectivity and less mortality, and active surveillance and quarantine is less effective. So we decide early diagnosis and treatment is more important with the antiviral drugs such as Paxlovid and Lagevrio. And we recommend to prescribe medication to treat COVID-19 by ages. Over the 60, we strongly recommend to prescribe even if they have lots of contraindicated medications. We recommend stop the contraindicated medications as long as 5 days. And next slide, please. I think it is possible that coronavirus that now causes the common cold OC43 was responsible for Russian flu of 1889, which killed 1 million people. But OC43, like other coronaviruses, become less dangerous with time. Today, most of us are exposed to OC43 and other endemic coronaviruses as children, and we experienced only mild symptoms. For SARS-CoV coronavirus 2, such a future could be years or decades away. Next slide, please. And the second topic is long COVID. The second agenda is the prevention and care of a post-COVID condition, as Japanese Medical Association presented, such as long COVID. I have no idea of prevention. We cannot know now how to prevent it, but I want to focus on clinical treatment of long COVID. So I think we don't know the symptoms of long COVID. As you know, many viral diseases and some other infections make complications like as COVID-19. We need more clinical study to find the mechanism of the sequelae of viral infections also. Next slide, please. I think it is the more important to prevent long COVID. We have to reduce the infection rate. This is the COVID-19 data at August 23rd, 2022. On this slide, the incidence of COVID-19 changed by ages. Below 20 are increased at the period of July through the August, then the April and through the June. It's on vacation. During vacation, below 20 ages group has more social activity. Yeah. So to prevent of transmission is below 20, self-precaution with mask should be taken before symptoms and after isolation by people. Next slide, please. The increase of prevalence below 20 forced to change the strategy to prevent rapid spread of infections. So in this group, self-quarantine at the beginning of the infection and self-cautions after 7 days isolation are essential. Next slide, please. And the third topic, improving the healthcare system for post-COVID world. To manage variable COVID-19 patient, we need for more flexible healthcare system, such as contact medical system and non-contact medical system, and telemedicine and home care system. And then to reduce the mortality of severe and chronic patient, we have to plan to develop the critical care hospital with a transportation network for infections, and a special hospital for chronic infected patient also. Next slide, please. This is an example of remote medicine, so-called lifestyle or living treatment center. Nurses call the patient and make a medical questionnaire and take X-ray. Radiologist from university hospital check it. And we can transfer the patient who are aggravated to neighboring hospital. This is the unique system in Korea. Next slide, please. And for holistic healthcare in new era of Korea, I want to summarize first, as coronavirus is changing, the strategy for healthcare system should be changing together, such as to reduce mortality. Early treatment is more important than quarantine for Omicron variant. Second, for prevention of care of long COVID, we don't know yet. More studies are needed. Third, for entering new era of corona, it is essential to improve the healthcare system. We have to modify the traditional contact and non-contact medical system, such as remote medicine and telemedicine. Finally, National Special Hospital for critical and chronic ill patient with infection should be established in the near future. Next slide, please. I want to make a closing comment with the Charles Darwin statement. It is not the strongest of the species that survives, nor the most intelligent that survives. It is the one that is most adaptable to change. Thank you very much for listening.
Thank you, Dr. Park, Vice President of Korean Medical Association, and thank you for Dr. Yang. What an informative presentation by Korean Medical Association. Now we will have a 10 minutes talk break, a short break. Next session will start at 11:15 in India, 13:45 in Taipei, and then 14:45 in Japan and Korea. Please return by that time. Thank you. Ladies and gentlemen, welcome back. Welcome back. The third session will be chaired by Professor Dr. R.V. Asokan, the Health Honorary Secretary General, Indian Medical Association. Dr. Asokan, you have the floor.
Thank you. Thank you, Chair. I proudly represent my country, India, who had a very decent fight against COVID from our extraordinary government sector, ably assisted by a very large private sector. And I dedicate this talk to the doctor community which rules as one, and the sacrifice of 1,500 Indian doctors in the fight against COVID, mostly family physicians. I am proud to introduce our beloved Dr. Ved Prakash Mishra. India has 4 ancient texts called Vedas. We call him belovedly the 5th Veda. Professor Emeritus and a medical teacher par excellence, and a world opinion maker in the domain of medical education. Conferred with the highest national award by the President of India, Dr. B.C. Roy Award as eminent medical teacher. He has honorary doctorate from Indian Health Sciences Universities and has 88 registered copyrights in the domain of medical education. He leads the Data Mega Institute of Medical Sciences, Dean University as Pro-Chancellor, and our proud Dean, Academic and Accreditation Board, National Indian Medical Association, Delhi. He will deliver the talk on improving the healthcare system for the post-COVID world. Dr. Ved Prakash Mishra ji.
Thank you very much, esteemed brother, Dr. R.V. Ashokan sir, learned chair, learned representatives from various national medical associations, including Japan, Korea, Taiwan, and all other member countries. At the outset, with great humility and privilege representing Indian Medical Association and joining absolutely a chorus with Dr. Ashokan, that India, with its governmental propensity from the private sector and very ably in total commitment put across by Indian Medical Association, has definitely put a very brave and successful show in the interest of Indian population against the COVID pandemic. The theme I'm putting across for the consumption of this learned gathering today, ladies and gentlemen, is basically pertaining to improving the healthcare system after the COVID-19 pandemic. And I am putting across, not limited to my country, because the theme I am required to be describing is pertaining to the world as a whole. 3 backdrops, ladies and gentlemen, we need to keep in mind. The world has recognized health to be a global human right of every global citizen. And therefore, it is imperative that the entitlement to health turns out to be a fundamental right of every global citizen in every country. Extension of this health as a fundamental right turns out to be the core responsibility vested with the state. It's in that context, the COVID pandemic, which virtually shook the world and took it by storm, it has definitely revealed several chinks in the armory of the entire healthcare delivery system across the world. we need to admit that world is plagued by iniquities. The world is plagued by iniquity of distribution of resources. The world is definitely plagued by differential levels of development practically in all domains of human life and human prosperity. And therefore, the revelation which COVID pandemic has brought is independent of the economic status of the country, independent of the nature of the healthcare delivery system of the country. Practically, COVID shook the entire tenets of the healthcare delivery system across the world in spite of the iniquities and inequalities prevailing therein. Therefore, if I'm wanting to put across one dictum in terms of one-liner, I will put it this way, learned chair, that yes, COVID shook the tenets of the healthcare delivery system across the globe. But then, COVID has also opened the eyes of all of us across the globe that now from the phase of shock, we need to rise to the phase of reforms. For simple reason, because if you take into consideration the three important areas where the revelation has come, perhaps the core of the ethical consideration that cropped up during the pandemic management, the inadequacies of the regulatory frame that were vividly put across, the various legal concerns which came to fore, they all confront us and confront the entire global community as challenges. The reality check, if we look dispassionately, independent of the geographical boundaries, we will be finding that the COVID pandemic has absolutely vividly revealed that overall preparedness of the countries in the world pertaining to tackling epidemic, including COVID-19, was palpably inadequate. Infrastructural propositions in terms of men, money in the form of resources and material, they were also palpably found to be inadequate. The acute care capacities, definitely chinks in the armory in terms of inadequacies came to fore. The surveillance and monitoring mechanisms definitely compel us to realize that something was wanting since badly and heavily. The entire policy perspective delays, another important aspect which stands revealed. And the last important parable, the entire pandemic in last 2.5 years has resulted in such a heavy impact on the economy that an economic recession prevails the worldwide. And therefore, ladies and gentlemen, if we dispassionately look at these revelations, then perhaps the model of healthcare delivery system, which we adopted as a part of the developed world, perhaps it is the centralized nature of the healthcare delivery system and the hospital centricity, which has turned out to be the soul of it, perhaps is one important aspect which needs to be given a firm review. And therefore, what exactly is the lesson which we need to learn and how exactly we intend to move forward? My humble observation on that count is, having realized the plague limitations of centralized and hospital-centric healthcare delivery system, we need to work out a decentralized healthcare system, which is absolutely standing on the tenets of A, equitability, and B, effectivity. This, according to me, is the most blatant lesson that world community is required to be learning out of the COVID pandemic. It is important that we invoke absolutely meaningful, cogent, credible, distributed network of clinics and hospitals for the purposes of extension of desired care. The third dimension which I'm wanting to advocate is that from a modality of model of task shifting and task sharing is yet another important dimension which needs to be taken into account, and absolutely a meaningful, judicious, and very desired level of application of technology in the domain of healthcare turns out to be a reality in terms of the reform. Therefore, in a nutshell, when I'm talking about the four-way approach on this particular count, I would summarize that in one sentence, whereby I mean that perhaps overemphasis of the world global healthcare delivery system in the curative domain stands definitely exposed in regard to its inadequacy, vis-a-vis capacity to handle a pandemic like COVID. And therefore, ladies and gentlemen, perhaps the healthcare model is required to be having a fresh relook in terms of not laying overemphasis on creative medicine isolation, but realizing the importance of preventive medicine and the domain of public health, which is required to be given its due fillip, given its due importance, given its due share, and given its due propensity for development. The levels at which the reforms are required to be undertaken contemplate three distinct levels, in my humble opinion. A, the level of every individual citizen. The level which I call as the societal level. And the third is the level which is the governmental level in terms of policy frames and policy requirements. What could be the modalities? I am crystallizing the modalities in terms of flagging the cardinal incorporation therein. One, there has to be a desired emphasis on preventive care. Ladies and gentlemen, the inadequacy of men, the inadequacy of manpower definitely has brought us to a situation where it is imperative that telemedicine network turns out to be one of the important modalities of taking care of the population at large in terms of its health requirements. This mandates that the digital divide, which prevails substantially and very heavily in developing country, turns out to be yet important priority for the purposes of bridging the gap. But as a matter of fact, without bridging the digital divide in terms of the plagued connectivity, impoverished in nature and inadequate in character, it will never be in a position to work out even the telemedicine networking without the incorporation and bridging the gap of digital divide. It will be mandated that we need to work out improved surveillance and monitoring mechanisms. Those improved surveillance and managing of the monitoring mechanisms alone will be in a position to go in for desired data analysis, which turns out to be the seat and soul of an effective healthcare delivery system, which is wanting and which is absolutely substantially marginalized in the present context. Ladies and gentlemen, labor force turns out to be one of the cardinal requirements. And when I am talking of the labor force which contemplates the entire health team, including preparedness in terms of epidemic management. And therefore, when I talk of labor force, I incorporate three important stages in it. One, timely recruitment of the manpower. Two, efficient and meaningful training to the manpower, including its periodical update. And number three, prioritization of the use of manpower in the form of a task health force. This is the trinity of the principles which, according to me, ladies and gentlemen, will work out a desired reform in absolutely a meaningful direction in the post-COVID era, when we are contemplating to go in for revamping and reforming the entire healthcare delivery system. This means that we will be required to be strengthening the logistics. We will be required to be strengthening the supply chains. We will be required to be working out networking of telecare. We will be required to be incorporating effective and meaningful surveillance systems. We will be required to be putting across meaningful monitoring systems. We will be required to be putting across appropriate mechanisms of data analysis, and simultaneously, we will be required to be ensuring that the ready-made labor force is worked out for the purposes of tackling the situations as would be warranted from time to time. Ladies and gentlemen, when I contemplate all this, this will mean, as I said, at the governmental level, 3 or 4 important frames to be adopted, independent of the geographical limitations and boundaries. Number one, health funding turns out to be one of the cardinal issues. When I speak for my country, India, 1952, a recommendation was made by the expert committee that for the purposes of effective development of healthcare system in a developing country like India, 6% of the GDP should be put across in the domain of health. Ladies and gentlemen, in the last 70 years, in spite of this speaking recommendation, the public funding in the domain of health has not been able to touch even a 50% mark. The entire proposition of reform and revamp, which is generated as a result of the shock that the COVID management inadequacies have revealed, mandate that we will be, every country is required to give a rethinking in regard to appropriation of funding for catering to the cause of healthcare delivery system, keeping in mind the prioritization that it enjoys within itself. Number two, meager health expenditure will not do, ladies and gentlemen. It has also revealed that our arena of research and development in the entire profile definitely has been weak worldwide, barring maybe few exceptions here and there. But in a generic sense, it is imperative that funding amongst the health, in the health funding for research and development in the domain of healthcare, in the domain of health therapeutics, in the domain of health prognostics, in the domain of health rehabilitation, and in the domain of health diagnostics as a whole, ensuring all the four arms are put across for appropriate, meaningful, cogent, credible, timely, and an ongoing open-ended funding for the research and development profile, both through institutional mechanisms, including individual scientific-based research mechanisms in any and every country. Ladies and gentlemen, as I said, COVID has also revealed the chinks in the armory pertaining to the regulatory frame. I am not here in a position to prescribe what exactly will be the content of the regulatory frame, but the intent of the regulatory frame which is required to be put across has been realized, and therefore diligent steps need to be taken by the policy makers and policy framers to be working out on this direction forthwith for the purposes of putting into place the desired reforms in the healthcare delivery system. And more than that, there has to be an effective monitoring and evaluating mechanisms, which should also have a statutory force for the purposes of ensuring a required level of responsibility and accountability. Ladies and gentlemen, an important aspect which has to be definitely taken note of is, whenever we are talking of healthcare delivery system, it has to be viewed in the context of three important tenets of principles, and they are the principles of availability, the principles of accessibility, and the most important principle is of principle of affordability. The entire healthcare in terms of the reform, if it is losing the track of handy availability, easy accessibility, and within the pocket affordability, it will absolutely be as meaningless as it has proved to be. Therefore, it is that those out-of-pocket expenses which stand absolutely revealed in the entire pandemic of corona, and a review in the health insurance model, which turns out to be one of the stark realities, also needs to be given a rethinking. There could be economic models which can be worked out by the respective countries. But believe me, ladies and gentlemen, one of the important aspects which also stand revealed on this particular count is equity, equitability, and affordability as one of the important considerations which has to be taken note of. It is in this count, ladies and gentlemen, definitely corona pandemic has, the shock generated thereout has practically opened the eyes of every well-meaning health sector practically across the globe. It is imperative that we need to work out a global network on this particular count for the purposes of ensuring that the required revamping, it cannot be just labeled as a healthcare delivery system in country A, B, C, or D. It has to be a network healthcare delivery system, which is required to be taking care of the global healthcare in the real parlance, perhaps in terms of the true lesson that humanity needs to learn out of the COVID-19 pandemic. The Indian initiatives on these count absolutely are well-meaning. But yes, Indian Medical Association, taking note of the corona pandemic and the administrative efficiency which is required there too, has advocated and made a strong cause of generating an Indian medical service, an administrative cadre of the specialists for the effective management of both policy laying, policy planning and policy execution with the entire health task force across the country. And we expect that even Indian medical services turns out to be a reality in terms of the revamping of the healthcare delivery system in the context of an era which can be said to be post-COVID pandemic era. Let us rise in unison for the required reforms in the interest of men, mankind, humanity, and humanism as a whole, so that the world turns out to be a genuine and a better place for human habitation and capable of tackling any number of pandemics and epidemics in times to come meaningfully, successfully, with courage, conviction, capacity, hope, and resilience alike. It is this ethos of the reforms which definitely can make a meaningful stride onto the path that the global community intends to mean. Thank you, Chair, very much for giving me this opportunity on behalf of the Indian Medical Association to put these profile of thoughts on behalf of the IMA for the consideration of the all concerned. Thank you, Chair, and thank you, Dr. Ashokan, very much for this opportunity. Thank you.
Thank you, Dr. Vedprakash Mishra, for bringing the focus on public health and the government leadership and prevention and the role of Indian Medical Association. Thank you, sir. I return the podium to the chair. Thank you.
Thank you for that. Thank you, Dr. Ashokan and Dr. Mishra. We all enjoyed the energetic talk given by the Indian Medical Association. Now we are moving on to the fourth session. Let us invite Professor Dr. Taiyuan Chiu, President of Taiwan Medical Association and the President of CMAAO, to chair this session. Dr. Chiu, please.
Thank you, Dr. Jiang. Taiwan Medical Association is pleased to invite our distinguished speaker, Dr. Brian Zhang, to talk about building a community-based, patient-centered healthcare system. Lesson learned from the COVID to deal with all kinds of challenges about acute and chronic illness. Dr. Zhang is a family physician and has degrees in public health. He devoted himself in community medicine for more than 20 years and has joined several projects concerning healthcare network and infection control. He is the Secretary General of TMA and is well acknowledged of the role of TMA in the containment of COVID-19. Let's welcome Dr. Jiang for his presentation.
Thank you, Professor Chiu, for your kind introduction. Good afternoon to all the honorary guests at the webinar or on the broadcasting network channels. The whole world has been suffering from the COVID for more than 900 days. The way of living has changed a great deal. From mask mandate to keep social distance, and our socio-economic daily practice differs. As the viral strain evolved from Alpha, Delta, Omicron to the current BA5, the viral content strategies also adjust accordingly, from border restriction, case tracing, isolation, to vaccination and fast screening and treatment, trying to find a way to coexist with the virus and return to normal life. It is imperative to keep record of the experience of our learned. So next time we won't sacrifice so much and will be more efficiently return to the normal life. It also gives us a good opportunity to rethink about our healthcare system. When a pandemic attacked our society, a community-based, patient-centered care is the solution to both preserve medical capacity and maintain high-quality care. In the next 15 minutes, I will show you how Taiwan could build a network of care upon this concept. Next, please. Let us take a look at the current condition of COVID in Taiwan. Next, please. As you might have been aware, Taiwan has suffered from local COVID-19 surge since the end of April. The daily new cases are above 15,000. The peak has passed and the curve was flattened. Can you see the point? No? Okay, next please. Previous one, 前一张. With the statistics from the April 1st to August 9th, over 99% of cases are mild or asymptomatic. Next slide. And the death rate is around 0.19%, which is still higher than the normal death rate of seasonal influenza. Next slide. So we still have to watch the trend of the COVID-19. With more and more countries to reduce the restrictions and also the low severity from Taiwan's infected cases, we are entering a new phase to coexist with virus. There are three goals for this new phase. One, prevent progression, severe disease, and control the occurrence of fatal events. Second, manage patients with mild symptoms. And third, adapt to live with COVID-19 and stay safe. We need to build a tiered healthcare system. The clinics and hospitals both have their duties in screening and diagnosis, treatment, home isolation care, and vaccination. Under this approach, even with the rising of cases, we can still secure our medical capacity. We use the tiered model in COVID case management. The patients were triaged. Hospital-based care for severe cases, while community or home-based care for mild cases. In New Taipei City, more than 85% of the confirmed cases were shifted to the community for further care, and the percentage is increasing. This is the flow chart of patient care. We saw the confirmed cases, we referred the cases to clinics, and the clinics entered patient data on HEAS. So the home care for the COVID-infected patients with less severe symptoms can be managed by the community teams. And clinics can evaluate and treat patients with telehealth counseling. As for the treatment, both clinics and hospitals are able to prescribe antiviral agents for high-risk infected patients, such as the elderly. This is the flow chart for the doctors in the community to use telehealth devices to treat the patient. And we also have indicators for high-risk patients to give antiviral medications, as you can see in this chart. The TMA published a Taiwan model for tiered primary healthcare for the long fight against COVID in 2 years ago, 2020. We have documented our experience, forcing the possible consequence, reminded the CDC to plan ahead, and hopefully we can have the best results with the least sacrifice. TMA established a special interest group to work on the guidelines of collaborative work for managing novel pandemic pathogens. We have 18 meetings during the second half year of 2020 to finalize the draft. The draft was then circulated to CMAAO countries for review and comments. On September 3rd, 2021, the General Assembly of CMAAO approved the Taipei Statement on collaborative work for managing novel pandemic pathogens, as it will become the guideline when we face the future epidemics. It provided policy recommendations in 5 aspects: primary care physicians, healthcare system, health education, the role of medical associations, and the role of government during the time of rapid spreading and the time before or afterwards. I will report to you part of the contents of the statement, focusing on the healthcare system and roles of national medical associations, and will take this as an example to show how Taiwan will fight against COVID as we enter a new phase to coexist with the virus. This is the preamble for the statement. The word collaboration is so important, whether it is domestic or international wide. This statement calls for collaborative work for all parties involved for preventing and managing novel infectious disease in all aspects, hopefully curbing the pandemic nowadays. I thank Japan, Korea, Singapore, Thailand, and India for their comments during the meeting. Due to the time strain, I will only show parts of the statement. This is part of the recommendations for primary health care and physicians. As you can see, the primary health care infrastructure for community surveillance and referral for suspected cases. The primary care physicians will provide remote medical consultation and monitoring of physical conditions for persons quarantined at homes. And they have to prepare clinics with ample support and should be able of handling suspected viral cases and provide referral to the second and tertiary care centers as required. As for the hospitals, medical centers or designated hospitals, they will accept the referral and provide care of patients with confirmed diagnosis, requiring hospitalization and quarantine. They maintain medical care capacity, reduce non-necessary and non-urgent operations and treatment to reduce the strain on healthcare system, to prepare for potential surge. And third, when number of cases increase rapidly, redesign facilities layout to admit more confirmed patients. And this part is the recommendation for national medical associations. In Taiwan's experience, close collaboration between the National Medical Association and the national health authorities is the key to successful prevention and control of the pandemic. They should assist the national health authorities in distributing PPEs. They should help health facilities, including medical centers, hospitals, and primary providers, to compensate for the increased expense. They should coordinate with the donation of medical supplies from local organizations and distributed them according to the need of community hospitals. They should strengthen the public outreach of clinical monitoring in each community and formulate a tier system customized for the community. They should strengthen international communications, share experience of pandemic prevention and promotion. When the number of cases increases rapidly, national medical associations should help coordinate with government to seek the balance between the fundamental rights and medical personnel well-being of the societies. And there's still lots of the guidelines, but because of the time, I cannot show you all. I think you can find all of them in the CMAAO website. Now I'm talking about the future planning. The future planning from the Taiwan is to increase COVID vaccination rate among the elderly. And we now vaccinate to the children between 6 to 11 years old and below 5 years of age. School-based screening, treatment, and vaccination programs were implemented. We are looking for the holistic care approach. I will show you an example of community healthcare groups providing influenza control. And we should watch for the post-COVID condition care, as most of the speakers mentioned in the previous sections. These are the statistics concerning the vaccination. Compared with some Western countries, the vaccination rate of Taiwan seemed adequate. The booster doses are the lowest, as you can see in the chart, among the age over 75. Since our fatal cases are mostly the old ones with comorbidity and under-vaccinated groups, we still need to advise on vaccination. And also for children between the age from 6 to 11 or the age below 5, we provide vaccinations. The school pandemic control is an important issue. We suggested operation procedures to work with the already set up community healthcare network. With online learning and telehealth, we can contain the pandemic and the future further spreading. As for the infected patient care, we propose the past model of influenza care. As shown in the chart, we give the fever checkup, we give the fast screening, we prescribe antiviral medications. And we have shown that with the in Taipei, with the 284 clinics working with the public health centers and local health bureaus, every individuals are able to reach one clinic in only 8 minutes distance. That shows a good accessibility and efficient for the community network. I just show you the map. This map of Taiwan, this is Taipei, and this is one of the district called Shilin. And you can see all the red dots are the clinic. They are able to give the fast screening, to prescribe, and to treat the patient, and even give the 7-day quarantine home care. So this is the person-centered care model for COVID in Taiwan. We can do all the following things at a visit in one clinic. We give fast screening. We have availability of antiviral medications. We establish clear workflows in infection control planning. We give telehealth care. Some use the line apps, some use the videos, some use the telephones to follow up during the self-isolation period. And we established a rapid referral to the hospitals if necessary. And all these clinics are ready for the post-COVID condition care. Until now, 30% of the clinics can give the telehealth for the entire population in Taiwan. Under this model, we provide a comprehensive care. I think this is the conclusion to my speech. The COVID has changed our life and ways of healthcare. People are socially distanced and receiving telehealth care more frequently. However, sharing and exchange information take place more often. Collaboration will enable us to devise effective strategies to combat epidemics in terms of diagnosis and treatment. Viral evolution and post-COVID conditions has prolonged the fight against COVID. We need to be resilient and prepared. Hope the day will soon arrive when we can travel without worries or restrictions. Thank you.
Thank you, Dr. Cho, and thank you, Dr. Zhang. I'm sure all the participants, just like me, enjoy the talk as much as I. Now we will take a break before we start the Q&A session and the panel discussion. 15 minutes later. The symposium will resume at 12:10 in India, 14:40 in Taipei, and 15:40 in Japan, Korea. Please do come back 15 minutes later.
Please, everyone on the platform, you can use the texting on the platform during the break time if you have any questions. Thank you.
喂，连大夫上线，请问有没有听到？
而且你要遮着，
趁这2个小时打壮一点。
那几个钟？那几个钟？
个10分钟。10分钟，咱用小可以打灯来坐。
这样人就照相这里。
好，理事长，我上线了，有没有听到？
有。总统，请他挑几个总统。
OK， 好，有，好。
有总统那个挑几个像。不有。
ladies and gentlemen, welcome back. We are moving on to the Q&A panel discussion. Dr. Brian Zhang will lead this discussion. I would like to welcome all the moderators and the speakers to join. As for the participants, if you have any question, please raise your hand in the room or leave your questions in the column below the chat tube screen. Dr. Zhang, you have the floor.
Thank you. Thank you, Xian Zhen. I'm Dr. Brian Chen, the moderator of this panel discussion. I want to take this opportunity to thank all the CMAAO guests and experts to join this conference. It is because of your unselfish sharing of information, so we can effectively control the pandemic. In the previous sessions, JMA reported to have been attacked by several waves of new COVID, and the infected numbers are increasing. The chronic care, the long COVID, is a challenging issue, and studies on symptoms and treatment bring evidence for further care. Our KMA experts share their current conditions of COVID and content strategy through vaccination, telemedicine, and home care. Early treatment with Paxlovid to the elderly was also suggested. Increased evidence in adults below 20 years of age was also noted and need to be followed up. The IMA revealed the idea to a new healthcare system, and they mentioned about manpower control, more research for the scientific evidence, and we should provide a platform with effectiveness, good accessibility, and affordability. And I also highlighted several important policies with Taiwan's perspectives, especially on the home-based acute and chronic care through community network, vaccination for prevention, and collaboration between hospitals and clinics through their tiered healthcare system. This is I summarized the previous sessions for all of you. So now it is time for the questions from the floor. And if any experts would like to add more information, please raise your hands within the Zoom maze. So first I saw the questions from the Dr. Yang, who leaving the text on the Zoom. Dr. Yang, are you there? Do you want to raise the question by yourself?
Yeah, thank you very much. Actually, we're gonna change to the principle to manage the COVID-19 patient. Actually, over 60, we have to reduce the mortality. So we have to, early treatment is most important. So we want to prescribe antiviral agents such as Paxlovid and Gebrio, but it is very hard to increase the prescription because the doctors avoid because of the lot of the contraindicated medications, and people don't like this medication is well known, a lot of complications. So I want to ask, is there any hurdle to prescribe antiviral agents such as Paxlovid and Gebrio in your country, and how to manage it?
Okay, thank you, Dr. Yam. I think the question is for our friend from Japan, Taiwan, and India. So is there any the speakers from the JMA wish to respond to the question about how to prescribe?
はい、釜谷です。お答えいたします。我が国でもパキロビッドパック、それからラゲブリオの処方は必ずしも進んでいません。理由はまずその処方、そして実際に薬が届くまでの手続きがまだ煩雑であること、そして、特にパキロイドパックについては、併用することができない薬がたくさんあるので、なかなか進んでいません。日本の現状を申し上げました。
With which Paxlovid cannot be used concomitantly. So these are the reasons and the Japanese situation. Thank you.
Okay, thank you, Dr. Kamayachi. And what about the prescription in India? May I ask the speaker from the Indian Medical Associations?
Yeah, prescriptions in India largely are regulated in the government sector. And antivirals, our experience is related. In the sector, there is not much use of antivirals, except the initial stage where the steroids are massively used. That is around 60 milligrams. So the usage in the sector is mostly on the steroids concentration of observing the lung damage.
Okay, thank you, Dr. Asokan, for your response. And as for Taiwan part, I want to introduce the guest, Dr. Yan Muyong, who is an infection specialist and participated in several government projects of the infection control. Dr. Yan, could you respond to this question about how to prescribe Paxlovid in Taiwan, and also maybe give us a highlight on the Taiwan's post-COVID conditions control? Thank you. Dr. Yan, can I hear you?
Okay, can you hear me? Can you hear me now?
Yes,
okay,
thank you.
it's my honor to join this important international conference, especially to my colleagues in the India, because we have learned a lot from the CMAAO weekly meeting, which was moderated by our colleagues from India. And as for the Paxlovid, the strategy of Paxlovid in Taiwan, initially we have difficult to implement the application to general populations. But we had to set some kind of criteria. We did not give it to the general population. Instead, we have several criteria like immunocompromised or for had aged over 65. But one of the major break is that we had a connection to our community medications, community physicians. So every local primary physicians can prescribe the Paxlovid through the video visit. So it's become very effective for those patients who are with mild illness can receive the medication very conveniently. And the next I would comment for the trend and for the Taiwan's the perspective. We all know that Taiwan CDC is now heading for to live with virus, but our strategy is not to fully open and live freely with the virus. Instead, we cautiously to take the chance to have a peaceful living together with the COVID virus, because Taiwan had learned a lot of lessons. In the past 3 years, we had the 2 epidemics, local epidemics, but we get it through quite well, based on 3 components. First of all, is that we have a traffic control boundary system and triage all the way to the community primary physicians. And secondly, we have a very restrictive discipline in the civilians who can wear in the mask and wash hands with alcohol-based strategy, so that actually we have confidence that Taiwan's community can adapt it to the future trend with the so-called live together with Omicron and BA.5 to come. And for the post-COVID strategy, I would emphasize that we should focus very much on the long COVID syndrome. And generally, it takes about 20-30% of long COVID right now. Taiwan, in 2 years ago, we have 5% of long COVID. But now that we have gaining more and more experience, we will see that increase the demand of the populations for the integration and the holistic management of the long COVID in the future. I would comment that education for the awareness and surveillance and reporting to gather more data and tell the real picture of the long COVID epidemiology in Asian countries. In addition, we should develop integrated care model and to the local clinics, primary physicians, coordinating different medical specialists in different departments to provide holistic support for patient care in response to post-COVID era, especially we can see so many emerging infectious diseases right now in the future. Thank you.
Thank you, Professor Yan. I also asked one thing that the TMA for the for helping the primary care physicians to prescribe about the antiviral Paxlovid medications, the TMA worked very closely with the special societies to host several online education programs, so everyone could correctly to use the medication without severe side effects. And I also see some friends from other countries. From Dr. Zhou, are you willing to share some experience from the Singapore? Please, your microphones.
Thank you very much, Brian. I'm sorry. Sorry, I didn't mute myself. I did unmuted myself. Hey, I have posted a little guideline on how we prescribe Paxlovid in Singapore. And general practitioners, there are about 35 clinics in Singapore that prescribe Paxlovid for a population of 5 million. The Paxlovid is free, but it's free. It costs about, I think it costs the Singapore government about $700 US for one box of Paxlovid. And it's prescribed free, but you have to meet criteria. And the criteria is posted on the chat. You can have a look at it. So for example, if you're above 60, and we don't count your birthdays as long as your birth year. If you're above 60, we will prescribe it to you. And if you're obese, overweight, and you have certain diseases like kidney, lung, heart failure, etc., diabetes, ongoing immunosuppressive treatment, this is our guideline in Singapore. So you can have a look at it. The patient, if he has COVID and has these criteria, will head to one of these 35 clinics across the island, and the doctor will prescribe the Paxlovid. And the Paxlovid is stockpiled by the ministry and very tightly controlled. Vaccines in Singapore, for example, the mRNA, the Novavax, the Sinovac, and the Paxlovid is very tightly controlled by the government. So, for example, we cannot prescribe it to foreigners and send it overseas. All right, it must be for Singapore citizens or permanent residents or people who are working with a pass in Singapore. They have an official work pass. So you can have a look at it. Thank you.
Yeah.
Thank you.
So can I have a question? So can I have a question to Professor Zhou?
Okay, also please proceed.
Yeah. Okay, Professor Zhou from Singapore. Now that you mentioned about the mRNA vaccines, I have one question to raise, because 2 years ago when we started for the mRNA vaccinations, we see many complications, and because Taiwan don't have long COVID then, but instead we see a very enhanced picture of a side effect. Several or so-called lots of autoimmune disease from mRNA vaccinations. One of the most frequently seen is the development of the herpes zoster in adults, in aged people. And I wonder if you have seen that scenario in your country. Yeah.
Actually, hang on. Actually, yes, we have seen some side effects from mRNA vaccines. For example, my own staff had Bell's palsy.
Yeah.
After the vaccine, 1 week after the vaccine, she had Bell's palsy, and so we excluded her from any more mRNA vaccines. And interestingly, about 6 months later, she had Bell's palsy on the other side.
Yeah.
So I mean, for a person who have 2 Bell's palsy within a
Very
space.
rare, yeah.
Very,
So
very
also,
unusual. And my cardiologist colleagues have also found that, for example, atrial fibrillation in young boys, like 14-year-old, 16-year-old boys with atrial fibrillation, young men with atrial fibrillation. So there's indeed some side effects from COVID, and but you know, at the end of the day, these were all reported to our central committees steering the mRNA vaccines and so on. And I think the final analysis is that, you know, the benefits of the mRNA outweigh the risks. You know, I think all the doctors in Singapore are very, I mean, we talk unofficially to each other, and we do keep a lookout for all these funny side effects. But I think overall, I would say that the benefits outweigh the risks. And as a result, I mean, I'm glad to say that, you know, Singapore has come out of COVID very well. We have a very high vaccination rate, more than 90%. In fact, including boosters, including four shots of mRNA, and a death rate of about 1,400. Still one too many, but you know, I think in the end, you know, my Hong Kong colleagues are not here, but you know, we always compare Singapore and Hong Kong, and because of all the non-vaccination in Hong Kong, I mean, the death toll was incredible this year. So I think we have to look at it philosophically and say that the benefits and the risks have to be weighed. And you know, in a big population exercise, I mean, you will have side effects, and you have some serious side effects. But I think in the end, the benefits outweigh the risks. Thank you.
I agree with your point, but I think the non-COVID is one thing we should look out.
On the vaccinations and the prescriptions, but because of the time, I think I saw another old friend, Dr. Wang Chet. Dr. Wang Chet from Thailand are still online. Because we have only 3 minutes left for this panel. May I hear something from the Thailand's perspective? Dr. Wang Chet is still online. Okay, I guess so I see Dr. JP. Dr. JP, you raise your hands, please.
Well, thank you, Chair. Didn't think we had a time for a discussion, but since I am the neurosurgeon, my perspective is that I completely agree with the infectious diseases the expert from TMA just who just have described. And among this, I am mostly interested in long COVID management. I know that we need to deal with the current situations like variations. However, it's about time that we need to move on for long-term management of these patients. And I think personally, I think it is time to redefine the definition of the long COVID, because it does not contain or describe anyone who has not had major symptoms, but delayed onset of newly symptoms, such as the cognitive dysfunction, like especially not only the elderly patients, but I'm most interested in young children, because they will be our leaders in the future. What I mean is, like, there has been great interest in minor head injury in the children. They developed up to like 10% of them without any serious complication of side effects from early mild head injuries, but they become to have delayed onset of the complications, such as the decrease in cognitive functions or intelligence. So and there has been studies such as long-term, the outcome of the ARDS patients from many other virus conditions. And there has been several studies indicate that over 20% of these patients developed major cognitive dysfunction after 5 years. So what I'd like to focus on is that that is, we need to use this opportunity, as the TMA has indicated that for the integrated patient care, I think we need to have some kind of consensus to make our government or each national government, if we can put together all efforts to move our governments to provide national survey of these prolonged or newly these symptoms or complications of long COVID, and make sure they will provide not only the financial support but all the administrative support that we all the population that we as a doctors, physicians face. I don't think we can solve these problems by ourselves, but I think we need the government support and their decisions to provide long-term management of long COVID the conditions. Thank you.
Okay, thank you, Dr. JB, for your comments and your sharing. Because of time, we can only allow another one to speak during the panel discussion. And I saw Dr. Wancha come back. Dr. Wancha, you raised your hands.
Yes, thank you. Thank you very much, everyone. Nice to see you here today. And it's a very good session that you have had this webinar. In Thailand, we are getting better now because you remember in 2019, the first case of the COVID-19 was found outside China, in Thailand, in Chiang Mai. And then in that time, we don't know anything about the virus, but right now we are learning more and more together about the virus, and we learn how it infected, and we get acquainted to this virus, and we found the vaccine, we found some kind of antiviral medication, but still there are still more variants to come. I don't know in the future which we may have more variants to come from the COVID-19, and we have to stay with them for a long time. And I think the long COVID is still a very problem in our community. We have to take care of our people to get away from the COVID, from the long COVID. So I think that we should keep close together and monitoring what's going on for the COVID-19 in the future. And if anything change in behavior of the virus, we need to learn from each other. We should compare, and get together again in the future if there is anything happen, and the treatment and the lifestyle of the virus may have changed. Okay, thank you very much indeed for today's discussion. It's really helpful and really educational. Thank you.
Thank you, Dr. Wancha, for your response. And also thank Dr. JB for reminding us that about the long COVID. We need a collective mind, and we need to follow up these issues. And maybe, I suggested maybe the next CMAAO gathering, we can talk the topic about long COVID. So I think it's time for the panel discussion. So I will close this session, and I believe that collaborative mind and exchanging knowledge is how we make the earth a healthier and a safer place. I think all the inquiries and all the information to share, I think all the honorary guests join this panel discussion. I wish all of you have a pleasant discussion, and I hope to see you all in the near future. Thank you. Back to you, Xianzhen.
Thank you, Dr.
Thank you very much. Thank you, everyone. Nice to see you.
No, not yet. Sorry. Thank you, Dr. Brian Zhang, and all participants of this panel discussion. Yeah, we have almost come to the end. We have almost come to the end of this symposium. Now, now allow us to Okay, now allow us to invite Dr. Taiyuan Chiu, President of Taiwan Medical Association and the President of CMAAO, to conclude the conference. Dr. Chiu, please.
Distinguished guests, ladies and gentlemen, good afternoon. First of all, I would like to express my gratitude to the wonderful symposium and all participants today. We now understand that patients who have recovered from COVID-19 may continue to suffer from the so-called long-COVID symptoms. Thus, it is necessary to provide continuous and comprehensive care for this group of population. The excellent presentation delivered by speakers from Japan, South Korea, India, and Taiwan are well received and discussed in depth. It is evident that healthcare system in countries have taken on a whole new dimension during the pandemic. They are not only adopted adequate preventive strategies and a patient-centered approach, but also focus on rehabilitative and psychosocial support with full respect for the sufferers. These endeavors are meant to ensure that patients receive optimal health care on the occurrence of non-COVID. Apart from being a president of TMA and CMAAO, I'm also a family physician. I cannot overemphasize the importance of tier medical system and the people-centered family-based care. When Taiwan was hit by a new wave of outbreak in 2022, primary care physicians shouldered 6 community-based tasks. 1, providing virtual health care to patients with mild disease. 2, verification of positive negative test results. 3, online consultation and prescription for confirmed cases. 4, COVID-19 vaccine administration. 5, promoting clinical-based PCR tests. And 6, providing medical assistance and collaboration for hospitals' outreach screening. According to the COVID-19 case management protocol for home care patients, frontline primary care physicians verified positive rapid test results through video consultation, assess the risk level of patient, and provide prescription advice and follow-up care. This method facilitates a strong relationship between the physician and the family. Physicians in community play the role of gatekeeper, allowing hospitals to focus on saving lives of patients critically ill with COVID-19. Our experience proved the effectiveness of a tier healthcare model. I have been an enthusiastic advocate for community diversion health services, which have demonstrated its value and advantage in sustaining health system capacity. It is essential that our epidemic response and the preparedness infrastructure strengthen in the primary health care, and we have become a strong foundation to build a solid and quality healthcare system. It goes without saying that new challenges and a new possibility come along with academics. Understand that concerted action at the regional and the global level is a must in order to respond to new epidemic diseases. TMA has been working closely with the World Medical Association in the past few years. TMA and the WMA hosted a virtual event, the COVID pandemic, looking back and moving forward during the 75th WMA session this year. On December 3rd, we are going to conduct a program in Taipei to follow up the scene. In the last CMAAO annual meeting last September, we announced the Taipei statement and established principles in dealing with new emerging infectious diseases. This event has been very useful for us to learn from each other and work together. As always, Taiwan stands in solidarity with population in need, with CMAAO members as well as the global health community. Thank you for making today's conference a success. I'm looking forward to seeing you again. Thank you very much.